Imagine a world where breast cancer treatment is tailored so precisely that no patient endures unnecessary suffering. This isn't just a dream, it's a possibility on the horizon. Researchers from the University of Kansas Medical Center and the University of Michigan have uncovered a groundbreaking approach, capturing cancer cells directly from a patient's blood to guide treatment decisions. But here's where it gets controversial. Could this method revolutionize care, or are we overlooking potential pitfalls in its early stages? Let's dive in. Published in Science Advances, the study suggests that analyzing cancer cells in the blood could help doctors avoid overly aggressive treatments for breast cancer patients. Fariba Bebid, PharmD, PhD, a professor of pathology and laboratory medicine at KU Medical Center, explains, "Our goal is to pinpoint biomarkers that differentiate patients who truly need aggressive interventions, like surgery, radiation, or anti-hormonal therapy, from those who might only require surgery or even no treatment at all." This could be a game-changer for the 2.3 million women currently battling breast cancer. And this is the part most people miss. About a quarter of these women are diagnosed with ductal carcinoma in situ, CIS, an early-stage cancer that hasn't spread. While their prognosis is generally good, the cancer can become invasive in 10% to 53% of untreated cases. Without a reliable way to predict this, doctors often recommend aggressive treatments like lumpectomy, mastectomy, or radiation therapy. But what if we could identify who really needs it? Early detection is saving lives, but it's also forcing younger women to make life-altering decisions without clear guidance, says Sunitha Nagrath, PhD, a professor of chemical engineering at the University of Michigan. Patients are often presented with treatment options without knowing which one aligns best with their individual risk factors. This uncertainty can lead to overtreatment for some and undertreatment for others, a stark reality when cancer recurs within 10 years for about 10% of patients treated with surgery alone. Enter the labyrinth chip, a device developed by Nagrath and Max Wicha in 2017. This ingenious tool separates larger cancer and white blood cells from smaller blood cells by pushing a blood sample through maze-like channels. With just a few milliliters, researchers can isolate enough cancer cells for detailed diagnostic testing. In the study, the team used this chip to analyze blood from 34 CIS patients at KU Medical Center, comparing the genetic profiles of circulating cancer cells with those from breast tissue biopsies. Here's where it gets fascinating. The cancer cells from tissue biopsies fell into 4 subtypes based on their active genes. 2 of these subtypes were found in significant levels in the blood, and they carried genes linked to disease progression, chemotherapy resistance, and platelet binding, a mechanism some cancers use to evade the immune system. This helps us understand what makes these cells circulate and potentially seed new tumors, explains Neha Nagpal, a University of Michigan doctoral student and the study's first author. But here's the controversial angle. The study found that Black patients had more cancer cells in their blood and higher immune suppression compared to white patients, mirroring higher breast cancer mortality rates in Black communities. While race itself isn't a biological factor, these disparities likely stem from environmental and systemic issues. This raises critical questions. How can we address these inequities, and what role does this technology play in bridging the gap? Looking ahead, the researchers are transplanting cancer cells from study participants into mice to track how these cells spread and progress. After 4 months, the mice showed elevated cancer cells in their blood, which were collected for gene sequencing. The team plans to monitor disease progression in both mice and human patients, aiming to identify which cell types and biomarkers predict metastasis. Funded by institutions like the University of Michigan Forbes Institute for Cancer Discovery and the National Center for Advancing Translational Sciences, this research is a beacon of hope. But it also invites debate. Are we ready to rely on blood-based biomarkers for treatment decisions? And how can we ensure this technology benefits all patients equally? What do you think? Could this approach transform breast cancer treatment, or are there risks we're not yet considering? Share your thoughts in the comments. Let's spark a conversation that could shape the future of cancer care.